washing my hands. Hello, Mr. Hoffman. How are you?
Doing well, thank you.
My name's Nancy. I'm going to be doing an assessment of your peripheral vascular system today. I'm going to start out by asking you a couple of questions. Have you ever had any problems in your legs with varicose veins?
No, I have not.
Okay. Any problems with pain in your calves or in your thighs when you walk that then stops when you rest?
No.
All right. And any history of problems with your blood vessels that you know about?
No.
Okay, all right, good. So I'm going to start out by looking at your upper extremities. And so just if you can hold your arms out, that would be great. And I'm looking at the color of the skin, and I'm also touching with the back of my hands to check temperature all the way down to the fingertips, so your skin is warm. The skin color is appropriate for ethnicity. I do not see any pallor or cyanosis. And I'm looking also at your arms for any lesions or anything abnormal, which I do not see. I see you've been out in the sun a little bit.
Yes, I have.
So it's summertime, so that's okay. And then as I move down the hands, I'm also looking at your fingertips. I'm checking for capillary refill by pressing on each of the nails on both hands. The fingernails are pink, which is normal. And I also am checking the profile sign, which I'm looking right here. The angle here should be less than 160 degrees. And so I see that the profile sign is at 160 degrees, which would be normal. So then I'm going to check your pulses. I'm going to start by checking your radial pulses. All right. So as I'm checking the pulses, I'm checking them at the same time so I can see if they are symmetrical. The strength, normal, is 2+. And I'm also checking the rhythm, it should be regular. And the rate should be within normal limits. And then I'm going to move on to the brachial pulses. And here again, I am checking for the strength. The rhythm is regular, and the rate is within normal limits. All right, good. That's all I need for the upper extremities. I'm going to look now at your legs. So I'm going to have you put your legs up, and if you want to lay back, if that's more comfortable, it's fine. So I'm looking at the lower extremities, first looking at the color, which is appropriate for ethnicity. I'm looking at hair distribution. And the reason for that is when there's poor circulation, sometimes then there's no hair on the lower extremities anymore. And I'm also looking at the lower extremities for any lesions or anything abnormal. It looks like there's a little something here where you got hurt. You have a little scab there. Did something happen with your leg there, Mr. Hoffman?
Yes, I was riding my bicycle, and my leg was going through a big mud puddle, and my leg came away from the pedal and scraped the pedal.
Oh, okay. How long ago was that?
That would be approximately 2 weeks.
Okay. Does it seem like it's healing okay?
It does.
Okay. All right. I'd be concerned if it was taking a long time for that to heal, but it seems like it's healing normally. All right. I'm also going to touch the lower extremities first for temperature. I use the back of my hands, and I come all the way down to the toes. And his skin is warm all the way down to the toes. And I've checked for any abnormalities. I'm also looking at if there's any venous pattern, or particularly the back of the legs is where you would look for any varicose veins, which I do not see. All right, and then I'm going to look at the toes. I'm looking at the color. I'm looking at the nail bed should be pink, and I'm also checking for capillary refill. Capillary refill should be less than 2 seconds, according to some authors, less than 3. According to other authors, you can document as less than 2 seconds or less than 3 seconds, or if it's very fast, you could document capillary refill is brisk. And then I'm going to be checking the pulses on the feet, okay? These are the dorsalis pedis pulses right on the top of the foot. And you want to check the strength. Normal would be 2+. The rhythm should be regular, and the rate should be within normal limits. Now, the way you find this pulse, there's a couple different ways you can do. You can just start from here between the first and second toe and move straight up. I like to find this bone that's right here and then just move laterally or towards the outside to find that. He has nice, strong pulses, so they're easy to find. Many elderly patients, it's very difficult to find their pedal pulses, and sometimes they're not palpable, in which case you would get a Doppler to try to find those pulses. And you'd look at other assessment findings to see if there is good circulation to the toes, like the color, the temperature, and the capillary refill. So next I'm going to check the posttibial pulse. So here's the malleolus right here, that bone, and you want to just slide your fingers right here. There's almost like a notch there, and that's where you're going to find that pulse. This one sometimes can be a little bit harder to find. You might see you have to move your fingers around a little bit, or sometimes you have to put your fingers in there and sort of even press up towards that bone. So, and you would check both of these. Okay, if you can find them and do that at the same time so you can check symmetry, that would be good. And again, you're checking the strength. His is 2+, it's normal. The rate is within normal limits and the rhythm is regular. Okay, good. And that concludes our assessment of the peripheral vascular system.